Hello, everyone. My name is Joanna Tenkate, and I work at Global Heart Hub as their patient community engagement and development lead, and I'm excited to be here today. For anyone who doesn't know, Global Heart Hub is an alliance of heart patient organizations and advocates aiming to create a unified global voice for those living with or affected by heart disease. This is a part of Global Heart Hub's Empower webinar series, where we partner with patient organizations around the world to respond to the questions and needs of patients. And this webinar is being jointly hosted by Global Heart Hub and Heart Failure in Lebanon in support of the shared commitment to reaching and empowering the global patient community and in creating a collective voice. Now, I want to welcome everyone to today's session, which is for anyone looking for information or support around understanding, preventing, or living with heart failure. This session will discuss Global Heart Hub's recent publication, Heart Failure, Your Guide to Your Journey, and offer tools and advice for all those living with or affected by heart failure. Just as a bit of housekeeping, I want to call attention to the fact that this session has live audio translations into Arabic. So if you'd like to hear the session in Arabic, please select the translation room at the bottom of Zoom. And I also want to note that this webinar is being recorded and will be made available online after the event. And with that, I'm excited to introduce our speakers today who will be covering this important issue. We will first be hearing from Aistė Štaraitė, a Global Heart Hub representative and heart transplant survivor who led the effort to create the guide. We will then hear from Dr. Angela Massouh, a board member of Heart Failure in Lebanon and an assistant professor, nurse leader, and cardiology clinical nurse specialist at the American University of Beirut, who will be presenting a clinical overview of heart failure. And we're then going to get into a discussion with heart failure patients who will be offering their insight and advice from their own experiences as patients and advocates. And so I'm just going to get us started, and I'll be handing it over now to Aistė.
Thank you very much, Joanna. Hello, everyone. My name is Aistė Štaraitė, and I'm a chair of Heart Failure Patient Council and Heart Failure Development Executive at Global Heart Hub. I'm a heart failure survivor as well, and as Joanna mentioned, I received my heart transplant a few years ago. I will present you the recently launched Global Heart Hub, Heart Failure, Your Guide to Your Journey, which is called a patient-friendly guide for the people living with heart failure. Next slide, please. So I will start with a quote, which came from the patient experience, which is, we know that there is a gap between what guidelines recommend and what happens in practice. And we as a community agreed that there is a need for a heart failure guide for people living with heart failure to educate on self-care and empower them to have a meaningful engagement with their care team. Next slide, please. This year, Global Heart Hub, as I mentioned, has launched the first ever global patient-friendly guide, Heart Failure, Your Guide to Your Journey. This guide was created by convening 3 regional workshops in Americas, Europe, Middle East and Africa, and Asia-Pacific regions, as well as holding 1 global advisory board review meeting with key leading experts in cardiovascular disease and shared decision-making. The editorial advisory board concluded of clinical experts such as specialists as cardiologists, primary care specialists, and heart failure nurses. We as well had on the board shared decision-making expert and obviously patient experts. This guide was based on European and American clinical guidelines agreed by experts in heart failure. Also, this guide is based on discussion with the representatives of patient groups worldwide. And of course, there are several other local, national, and international guidelines, all of which aim to ensure people with heart failure receive the best possible care. Next slide, please. On the next slides, you will see a QR code, which will take you directly to the main guide document. And if you would like to open the document on your device, you can simply scan the code with your smartphone or tablet with your camera app. And for the purpose of this guide, we wanted to assist the people with heart failure and their carriers. And to do that is to better understand the optimal care pathway to inform the expectations, and to encourage a more informed patient and doctor shared caring arrangement. It's just a small note that the main guide document was created to be available in the digital format due to the size of the document. Next slide, please. When we talk about the aims of the guide, this guide aims to help people with diagnosed heart failure and those currently being checked to see if they have heart failure, as well as their caregivers. This guide also aims to help people at high risk of developing heart failure because of their comorbidities. For some of these people, lifestyle changes and medicines can help stop heart failure from happening. And the other aim of this guide is to help people with heart failure take a full and active role with their heart failure multidisciplinary care team, or when talking about or agreeing the treatment. The care team oversees and delivers people with heart failure care. Some people want their care to take the lead. If this guide sounds like the people with heart failure, this understand what to expect and reasons behind the care team's suggestions. Next slide, please. Every person with heart failure is an individual. So this guide does not replace the advice from your care team, which may be influenced by local or individual circumstances. For example, some treatments or diagnostic tests may not be available in every country. And care team's advice also reflects people with heart failure, particular circumstances, and the way the heart failure affects them. If there are questions or concerns, people with heart failure should contact their care team or local patient group. Each section of the guide has references to more information. And let's talk about the content now. So the guide is combined of 7 topics followed by the clinical guidelines. Additionally, people with heart failure will be able to find information about their rehabilitation and anticipatory care, as well as tips living with heart failure. In the guide, people with heart failure and their caregivers will find the in-depth information based on the clinical guidelines on each of those topics, such as what is the heart failure? How is heart failure diagnosed? How is heart failure treated? What are devices and surgeries? Hospital treatments of acute heart failure. Information about the cardiac rehabilitation and anticipatory care. And of course, living with heart failure. In the guide, people with heart failure will be introduced to other people with heart failure who have different stories to tell and battle different daily challenges. Through the conversations with community, we often hear that people with heart failure are not sure what to ask their care team during the visits, or even what to ask to learn more about their condition. This guide provides a set of questions for each topic, which can be used to support the conversations and gives a chance to learn more about one's personal case and prognosis. As it is quite difficult to find the quality information about heart failure and its treatment, throughout the guide, there are a lot of references connected to reputable, clinically based information about the condition, which can support people with heart failure if they would like to go beyond and learn more about the heart failure. The references are marked across the guide, as well as the list is presented at the end of the document. And at the end of the guide, there is the section for even more reputable channels for more information and support. People with heart failure can browse on the links added in the Where I Can Get More Information section at the end of the guide. Patient organization lists are available on www.globalhearthub.org website. Next slide, please. When I mentioned previously, we talked about the guide, that the guide was created to be present in a digital format. But to make it easier, we have created the guide summaries, which we present 8 of them. The guide summaries has been launched last week, and those summaries present the key information from each section of the guide. The total of 8 summaries presents the possibility to print the summaries and take them to the doctor's visit easily. Mark down the areas patients might need more clarification from the doctors, or simply adding their own notes. Friendly guide summaries are created in a way for people with heart failure and their caregivers to have all key information anytime, anywhere. Where the main friendly guide document is for those who seek in-depth information with examples and guidance in a digital format. Next slide, please. And I would like to finalize this presentation with a quote from the guide, which says that, remember that you're not alone, and your care team and local heart failure patient group are there to help you to live the fullest life possible. Thank you very much.
Thank you so much, Aistė, for sharing this guide with us. I really think it is such a valuable tool for patients to have, especially those who are newly diagnosed or struggling to navigate their care journey. I would like to make a note for all of our attendees that we will be emailing a link to the guide after the session, so you will have access to it. And now I'd like to turn to Angela for her presentation on the clinical side of heart failure.
Thank you, Joanne. Okay, so you can see my screen, right? First of all, I would like to thank everyone who has attended. I am so happy to see hellos from everywhere in the world, from a lot of countries in the Middle East and outside. And this is an honor to be able to speak to you. And among the conferences that I present, this is dearest to my heart. So today we're going to talk about taking the failure out of heart failure. So the choice of terminology when we talk about heart disease and heart failure in particular has a lot of negative connotations. In this presentation, I will try to guide you on how to live a healthy life with heart failure. So what is heart failure? Heart failure is a serious medical condition where the heart does not pump blood around the body as well as it should. This means that your blood cannot deliver enough oxygen and nourishment to your body to allow it to work normally. That is why, for example, you may feel symptoms like tiredness or fatigue. It may also mean that you cannot eliminate waste products properly, leading to a buildup of fluids in your lungs and in other parts of your body, like the legs and the abdomen. And this is what we call in the field of heart failure edema. I'm going to put this video that is from the heartfailurematters.org that is available in a lot of languages, including Arabic. But now I'm definitely putting the English version here to tell you how a normal heart works.
Your heart is divided into two sides, the left and the right. Blood from your body enters the right side of your heart. This blood is low in oxygen. Your heart pumps this blood to the lungs. Here, carbon dioxide is removed from the blood and oxygen is added. The blood, now high in oxygen, travels back to your heart, this time entering on the left side, where it is pumped out to the rest of the body by the main pumping chamber. This continuous process ensures your body receives the oxygen and nutrients it requires.
The issue with heart failure actually happens in this main pumping chamber. So when this chamber is weak, the heart does not have the ability to pump blood outside of the heart and for it to reach the rest of your body. And in these cases, the kidneys are going to sense that there is limited or a lower amount of fluids in our body, and then they will retain fluids and they will retain urine. That's why you're going to see fluid overload. And also this high pressure in the pumping chamber, because of the blood that has remained in it, is going to cause a higher pressure in the lungs, and it's going to cause what we call pulmonary edema or fluids in the lungs. And what you are going to see as a patient would be shortness of breath, or also what we call dyspnea, or for example, the inability to sleep flat, where you need to sleep on multiple pillows so that you can breathe throughout the night. So particularly what goes wrong in heart failure. When you have heart failure, your body will try to adapt to this by actually trying to keep up with the amount of blood that your body needs. This is known as compensation. The heart is thinking that it is trying to compensate, but in real life, this is doing more harm than good, because your heart will increase the number of time it beats, and this is called tachycardia, to pump more blood around your body. It will also expand its size, which is called dilatation, by stretching to increase the amount of blood it can hold and pump out, as well as developing stronger, thicker heart muscle, which is called hypertrophy, to help it pump better. Tachycardia, dilatation, and hypertrophy do actually more harm than good, because these can actually worsen heart failure and worsen your symptoms. And this is particularly how we target therapies and medications and treatments to actually, fix these compensatory mechanisms. But the most important thing for you to know as a patient or a caregiver is that heart failure is not a death sentence. I see a lot of patients coming to us in the heart failure clinics, reading on the internet that people with heart failure die within 5 years, and 50% might die within the first year. And this is epidemiological data, but there are ways to circumvent that. There are ways to live a healthy life with heart failure. Now, I'm gonna provide you with few statements that we hear a lot from patients, and we will comment on them. So heart failure means your heart has stopped beating. This is actually a myth, because heart failure does not mean that your heart has stopped beating. It occurs when your heart muscle or valves have been damaged, and so your heart isn't able to pump blood around your body as well as it should. Heart failure is serious. This is actually a fact, because heart failure is a very serious condition and it can shorten one's life. However, by working with your doctor and nurse, you can get effective treatments, you can make healthy lifestyle choices that will both ease your symptoms, improve your quality of life, and actually prolong your life. And I will give you the advices in a few slides. Heart failure cannot be treated. This is actually a myth, because there are many treatment options available for heart failure that are very effective at reducing the symptoms. They delay the progression of the condition, and you should discuss these treatment options with your doctor. The heart failure guide actually that Aistė talked about actually provides you with the treatment options. So in a way, when you read it, you get more informed and you are able to make more informed decisions with your healthcare providers. If you have heart failure, you shouldn't exercise. I hear this a lot from my patients. It's very important for people with heart failure to exercise. This is actually a very important and part of the self-care that we explain to our patients. It's also important that patients do not overdo it. So the right amount of exercise can help to improve blood flow and alleviate some of your symptoms. Finally, heart failure is a normal consequence of getting old. This is actually a cultural phenomenon. People in the Middle East assume that when you get older, it is normal for you to be diabetic, to have hypertension, to have cardiac diseases. And this is actually a myth. And I'm sure it's available in many other cultures, but in my research studies, I have seen this very evident in the Middle Eastern population. Why is this a myth? Because heart failure is ageless and it affects all ages. Like, most people with heart failure are elderly. However, heart failure isn't necessarily a consequence of aging. It's a serious cardiovascular condition that can often be prevented and greatly helped with the available treatments that we have in our guidelines. So since your heart is already weak, these changes make your heart work even harder, and it actually ends up weakening your heart more. So that's why when we learn the self-care guides that I'm going to give you in the next few slides, you are actually going to improve your chances and improve your heart failure and your quality of life. Now, what are the risk factors for heart failure? And this is actually a slide from Global Heart Hub that says there are many risk factors, some of which are diabetes, a history of heart disease in you or any of your family members, iron deficiency, smoking, drugs or alcohol abuse, high blood pressure, and lack of physical activity. There are also specific tests that you need to have so that one is diagnosed with heart failure. And these include going to an expert physician, cardiologist in particular, getting a physical examination with a focus on cardiovascular, getting a blood test called BNP or pro-BNP that is available globally. Some countries, they have limited options for BNP and pro-BNP, but it is usually available and part of the guidelines. There's also echocardiogram, which is the imaging of the heart. There is electrocardiogram, which is when we look at the heartbeats. And there's the chest X-ray, because the heart and the lungs are linked and we need to see and check for any fluid overload. So what are the signs and symptoms of heart failure? And I'm sure for the patients among us, this will resonate well because you would have experienced those signs and symptoms. And for the carers and caretakers, just you should be able to know so that you help identify your patients when they have these symptoms. But before I do that, I want to talk a bit about the symptom experience. One of the things I always like to highlight is that symptoms are cultural phenomena because they differ between cultures. And this has been proven by research. When you look at the international literature, you see that people respond to symptoms based on where they are living, based on their culture, based on their healthcare systems as well. So for a bodily change to be seen as a symptom, it must be different in intensity or frequency, and it must be sufficient in magnitude, newness, or significance compared to the normal bodily sensations. And I'll give you an example. So I was in the clinic one day and I had a patient coming to me. She was obviously short of breath. She was, tachypneic. She was breathing heavily and she was short of breath because she had walked the corridor coming into the clinic. So I asked her when I was doing the symptom inventory, do you have dyspnea? Do you have shortness of breath? And she said, no. And I'm like, but you're obviously dyspneic. And she said, no, but that's my normal. I'm always like that. So for her, she was not able to see this as a symptom because this is how she lives. So I took her up. I made her walk and we walked down the corridor. She started feeling the dyspnea and I was walking normally. And I told her, normally, you should not be dyspneic at this short distance. So we had to explain what is the normal and what is the symptom. And this is called symptom perception. So being aware of your bodily changes. Also, bodily changes are interpreted as a function of their attribution. So for example, a lot of cultures believe that fatigue is a normal thing for older people. So they believe that with aging, one should be fatigued. So they do not link it to a heart failure symptom. Also, sometimes we might misinterpret our situation because we are not symptomatic. So I see a lot of my heart failure patients telling me that they feel okay, and some of them would stop medications because they do not feel shortness of breath or fatigue or palpitations. And I tell them, you do not feel those symptoms because you are on the right medications and the right lifestyle. Once you stop, the symptoms are going to be back. And the last concept I want to focus on is that when we have external stressors, like if we are sad, if we have family problems, if we have financial problems, this might actually cause hypervigilance and cause us to feel the symptoms more. Or in some populations, it might make us unaware of the symptoms because we are busy with something else. So the emotional situation and the external stressors of people living with chronic illnesses are important in their assumption of symptoms. So the New York Heart Association functional classification in 1902 had provided a four-stage scale to quantify heart failure physical limitations. When we say, and you might hear that in the clinics, when we say someone is NIHA class 1, that means this person has no limitations of physical activity and ordinary activity does not cause undue fatigue, palpitations, or dyspnea. When we say someone is stage 2, they have slight limitations, they're comfortable at rest, but if they go up 2 flights of stairs, they are going to be dyspneic. Stage 3, they have marked limitation. They are still comfortable at rest, but going like half a flight of stairs will cause the symptoms. NIHA stage 4 are those who are not comfortable at rest. They have symptoms. They're unable to carry any physical activity. So symptoms are either caused by fluid accumulation, and these include shortness of breath, coughing, wheezing, weight gain, swollen ankles, legs, or abdomen. They are also caused by reduced blood flow like fatigue, dizziness, and rapid heart rate, and other symptoms like loss of appetite, the need to urinate at night, depression, and anxiety are also attributed to heart failure. but 30% of people living with heart failure have no obvious symptoms. So if you are not symptomatic, it does not mean that heart failure has been treated or that you are no longer a heart failure patient. You could be a silent heart failure patient, and that's like 30% of the people with this disease. So in order to prepare you from moving from the hospital to your homes and the community, nurses and healthcare providers actually are the key link to teach you self-care behaviors and to help you find a place for the illness while keeping the illness in its place. So you are not defined by heart failure or by heart disease. This should be part of your life, but it should not define you. So in order to be able to live healthy with a disease, you need to perform 3 types of behaviors. Self-care maintenance, which means behaviors that aim at preserving, maintaining, or enhancing your physical and emotional well-being. And this could be taking a walk, not eating salt, going out with friends, maintaining your emotional, health or psychological health. Self-care monitoring are the process of routinely and deliberately monitoring and detecting changes in your signs and symptoms. And this could mean weighing yourself daily, taking your blood pressure, taking your medications on time. And self-care management would be the response that you do when you see a symptom. So let's say you took your weight on Monday and then you did it again on Wednesday and you noticed 2 kilograms of weight gain. So you identify that you have fluid overload, you call your physician, you take an extra water pill, you decrease water intake on that day, and you stop eating salt for at least 48 hours. That's called self-care management. And in order to be able to do that, you need to be able to understand your bodily changes and understand your symptoms when they occur, because research has shown that patients who do not understand their symptoms and identify them, they are less likely to be able to self-manage their diseases. So what can you do? Actually, this is also a slide from the Global Heart Hub. To improve your quality of life, you need to monitor your symptoms, keep active, keep a healthy weight and diet, look after your mind, limit alcohol and quit smoking, weigh yourself regularly, and take your medicines as prescribed. And I have them in more details with a few guides for you. The most important thing is to limit your fluid intake if you are in a state of congestion. So if you have weight gain, if you have edema in your lower extremities, it's important that you limit the amount of water that you take on that particular week. Do not exceed your allowed limit, and know that fluid exists not only in the water bottle that we drink, but also in foods like soup, in ice cream, in watermelon, in lots of fruits and vegetables. So you need to account for that. You need to eat a heart-healthy diet by limiting your sodium intake and keeping in mind that 1 teaspoon of salt equals 2,400 milligrams of sodium, and that's your sodium allowance for a day. And salt is not only the salt that you add on food, it's the salt within the food. And I'll give you a few hints. One of the most important things I tell my patients is to throw the salt shaker away, to buy fresh or plain frozen meat, chicken or fish, and fresh vegetables, to stay away from canned food. And if you have to use canned food, it's very important to rinse them well before you use them, to try to read all food labels to check if they have too much sodium, to avoid food that contain lots of sodium like canned food, processed or spread cheese, salted chips, ketchup and tomato sauce, vegetable juice, pickles and olives, soya sauce, regular or light, salad dressings, cold cuts, and salted roasted nuts. It's very important when you buy foods like cheese, nuts, butter, that you buy the low salt option, and to add extra flavors on your food by adding herbs, spices, vinegar, lemon juice, garlic. And I know that the international cuisines are now very diverse, and you would have options to add taste to your food without doing it by salt. You need to take your medications on time and as prescribed, even if you are asymptomatic. And if you skip a medication, do not double the dose when you remember it, because you do not want to take double the dose on any day. If you miss a dose, it would be important to call your healthcare provider or take a note of that so that you tell them the next time you're in the clinic. Do not take any additional medicines without asking your doctor. And anytime you are going to another physician other than your cardiologist, it's important to tell them the medications, the cardiology medications that you take, so that you protect yourself. Weigh yourself daily. This is very important. You need to weigh yourself each morning when you first wake up. It's very important to make sure to weigh yourself after urinating, before showering, and before eating or drinking. You should weigh yourself with the similar clothes, without your shoes, and with the same scale. And you should actually record the weight and get that data with you when you go to the clinic. And call your doctor if you gain 1.5 or to 2 kilograms in 2 days, because that will mean that you have fluid overload. And, preventing that or fixing it before it becomes acute exacerbation is very important. You want to maintain your blood pressure and heart rate. And remember, when we take our blood pressure and, for example, it's 120/70, the first number is your systolic, the 120, this is your systolic pressure. It's the pressure in the arteries when your heart is contracting. The 70, or the second number, is your diastolic pressure, which is the pressure in the arteries when the heart is resting between two beats. So recording both blood pressures is very important, because we increase your medication doses based on this information. And also your heart rate will tell us the pace at which your heart is beating. And also recording this will help us, up your medication doses when needed. Quit smoking if you do, because smoking puts a strain on your heart, and in heart failure, this is very dangerous. You need to quit all types of smoking, including hubble bubble, which is very prominent now globally, and cigarettes as well. And if you are unable to do so alone, consult smoking cessation programs. They are heavily available and they really help and support. And you need to stay physically active. This is a major myth and misconception for patients. You want to exercise, you want to stay active, but you want to allow rest periods throughout the day. Do not wait until you are breathless to rest. Space your activities, alternate them with periods of rest. And if you have heart failure, it does not mean that you cannot have sexual activity. You can still engage in sexual activity, because it is like any other physical activity. You do it. This helps your emotional state. This helps your connectedness with your caretaker or your partner. And this helps in your quality of life. Finally, take your immunizations. It's very important to ask about the pneumococcal vaccine, the COVID vaccine in this era, and the influenza vaccination every year. It's very important to follow up with your healthcare provider on that, because these should not be missed, because any infection will put a higher burden on your heart and might cause you to get hospitalized. Finally, it's very important to take care of your body, because it's the only place you have to live.
Thank you so much, Angela, for that excellent presentation. That was such a comprehensive overview of what it means to have heart failure and what you can do. And I really appreciate having your expertise on this call. I am now excited to turn to our three patients, who I'm so grateful to have with us today, to share their perspectives and the tools they have gathered from their own experiences as patients. So I would invite our three patient panelists to go ahead and turn on their video so that they can join the discussion. So I'm actually going to start, Aistė, with you. I know you've already had a chance to briefly introduce yourself, but I'm hoping maybe you could speak for a minute about your experience with heart failure and why you're excited to be on this panel today.
Thank you very much, Jana. So as I previously mentioned, I'm a heart failure survivor. I have been diagnosed with heart failure 7 years ago. My journey was like a little roller coaster. I was diagnosed unexpected. I actually had to live for 2 years with medication treatment, and then I had a worsening, which led me to the left ventricle assistance device, which I lived with for 3 years, followed by the heart transplant, which is now over 2 years. So a roller coaster journey. A lot of things happened, a lot of experience. Now I work with different organizations. I mentor with the patients. I'm active patient advocate, and I'm really looking forward to be in this discussion and actually have a conversation with my other colleague patients.
That's wonderful. Thank you. Now, if I could turn to Bouba Diemé, would you mind introducing yourself for us?
Hi, thanks for having me. I hope you can hear me well. Good, perfect. Yeah, so my name is Bouba. I'm originally from Mali and Senegal, which is in Africa. Grew up in South Africa and then found myself here now in Boston. So my typical location in terms of my health journey as well. So essentially similar to Aistė, is few years back, maybe 10 years ago, I was diagnosed with a condition which turns out to be a congenital condition. I was born with a heart defect, genetic defect. So fast forward, I went into heart failure. I was very athletic before, so it took us a moment to diagnose it. But I had to live with the LVAD pump, which is basically a pump inside my heart to help the heart work better, for about 6 years. And then as of maybe 9 months ago, 9.5 months ago, I got my heart transplant. And it's been a fun journey, but happy to be here and share notes and answer some questions.
Absolutely. Thank you so much. And lastly, Jacques Ekmekji, if you could please introduce yourself, that would be wonderful.
Okay, my name is Jacques Ekmekji. I was born in 1945, so I'm 78 years of age. And my experience with heart failure is rather recent, but my health condition started much earlier, which may be accumulated to that stage. First time I was admitted to a hospital, it was 2009. So, and it wasn't about heart failure. And then I went through cancer. I went through different diseases like spinal dural fistula, which underwent 4 different medical interventions. But all these things, of course, I guess, has put a lot of pressure on me. Add to this the conditions in the country. I mean, the conditions in the country should not be underestimated because, you know, Lebanon has been passing through a very difficult times in the recent years. Actually,
Absolutely.
during the COVID 2019, it was compounded with the Beirut blast explosion. As you are aware, it was, you know, a Hiroshima kind of that explosion, and it has put tremendous pressure on all of us, the citizens, the population of Lebanon. And therefore, this kind of accelerated, I think, at least my heart issue. Though my heart problems started in the mid-2015, in the 2015, when I started being treated for the heart electricity issues, the deficiency in electricity, or I don't know why, but I started on medication, and it helped me a lot to stabilize my balance and all that stuff. So it was a good treatment. Yes, this was with Cetalol 80 milligram. But then in 2022, suddenly I had my major experience with, I would say, heart problem. To say heart failure, because I was admitted to hospital in a very critical situation, and I was operated through TAVI. This is, you know, kind of for the replacement of the aortic valve. And since then, my situation is pretty good, in good conditions. I'm feeling all right in that respect. However, I'm still suffering from my spinal dural fistula, which is putting tremendous pressure on my body because it stresses my tummy and my legs and all these things, and it affects my heart, I guess, as well.
Absolutely. And I think that's something that we all have recognized from a lot of patients within this community, is that there's often comorbidities or other conditions or illnesses that you have to manage at the same time, and that does add additional pressure. So I really appreciate your attendance and your discussion on that topic as well. And I'm really excited to get into this conversation and talk more with all of you. So just to start us out, we have heard some background today on what heart failure is, but also that it has many causes, and every patient with heart failure can present differently. So I'm guessing that for someone who's newly diagnosed with heart failure, that can be very overwhelming. So, Bouba, I'm wondering if you can speak on some of those early days of diagnosis and how someone might start to get a better understanding of what their options are and what kind of support they need.
Great. Yeah, I think my personal journey, every journey is a bit unique, but there's a lot of similarities, like doctor said. So in my case, essentially, when I was maybe 25 or so, I started having a lot of chest pains, and at the same time, I thought I had a flu. So I treated the flu for like a month, but the symptoms still stayed, especially on my chest. And I used to run a boot camp, and one day I was trying to run like just to warm up, and I was struggling. I thought I was just unfit, but then it kept on being the same. So eventually I went to the hospital. So I was rather looking still healthy, but the heart was, they took a long time to test and do some x-rays, and then they came back and told me the heart was bigger than normal. And that's what was putting pressure on the chest, and hence the chest pain. But eventually they did more tests, and then we discovered that it was dilated cardiomyopathy because the heart grew big. So eventually, fast forward to many years, we did genetic testing, which is advancing, and eventually knew exactly what was happening. So in my case, I was born with a heart that was never fully formed. So over time, it kind of get bigger and bigger. So in hindsight, you can go back and connect the dots, say, okay, this is why I was feeling unfit, this is why I was struggling, but your body compensate, like the doctor said. So in my case, I was lucky to be with very good doctors that were technically good in terms of the care, but also good people that would kind of were very encouraging, give me information, explain to me why it was still important to stay active, but also not to stress, managing the stress, and so on and so forth. So that was probably number one. And the second one is mostly, family and friends, and, and also yourself, doing your self-care. So those were the places I think that I turned to, and those were the things that were very important. And of course, largely the environment, like Jacques mentioned, is that where you live, the pressure, so managing to deal with that, because you're also dealing with the extreme, pretty much constant pressure because you're dealing with heart failure. So that was my experience, and it might vary, but I think most of us have similar one.
Absolutely. So it definitely makes sense in those early days to lean on your doctors, lean on your care team, but then of course bringing in your family and your friends, because for many people, they're going on that journey with you. And if you can bring them in early, they can learn alongside you, and they can be sort of providing the support that you need.
Exactly. My wife will tell you, help me help you, so that was the same for everybody. But also expect patience. Caregivers affects everybody around you. Next thing you're not smiling, you're not active, you're not able to do this or that, you're gonna play, and people care for you. So, talking about it and understanding each other is definitely very one of the key tools. So yeah.
Absolutely, that makes sense. So something else that we hear from the patient community is that the resources, or maybe, when you are leaning on your care team and you're talking to your clinicians, some of what they say, or maybe a lot of what they say, can be full of medical terminology, very jargon heavy, very complicated. Aistė, I'm curious to know if that kind of terminology ever presented a challenge for you, and what advice you'd give to a patient who's struggling that way. And I'm assuming that's something you had to consider even when making this guide.
Absolutely. It's such a great question, because we do find a lot of good quality information, which is based on the medical terminology. And, even when I was diagnosed with heart failure, I was told that I'm having a heart failure, which I didn't even understand what that means. So it was difficult for me to really cope with everything and spend that time with my cardiologist and learn all those terms and trying to understand and cope at the same time that, what I understood back then, that I was dying, even though it was an end stage of heart failure. But I think it's very important to give a message out that there is a lot of information which is in lay language, which can be produced by the patient organizations on the national level. And for example, when we're creating the guide, the global guide, our key goal was to make sure that information is in lay language. So in the language that the people could really understand, and it would have a less medical terminology as usual as the clinical guidelines, for example. Of course, there are medical terms in terms about the medication names, or for example, about the surgeries which are done. They are the medical names. We cannot really change them, but we can really explain in more like human language, which is more easier to understand what it means and, you know, what benefits it gives you. So my recommendation to everyone would be, don't be scared with that medical terminology. It is okay to ask your doctor to explain it to you. And of course, find the channels that are suitable for you, that you can understand what heart failure is.
Absolutely. Thank you for that. And Jacques, I'd be curious to know your perspective here, especially considering the fact that not only are there issues with terminology. Oh, I think we may have lost Jacques. I think he may have dropped out by accident. Hopefully he'll be able to rejoin. But yeah, on the subject of looking for more information, we know that there are some challenges in accessing information online that's scientifically accurate. So we know sometimes things kind of go through social media, or you might find something on Facebook and you're saying, I don't know if this is accurate. I don't know if I can rely on this, but that is where a lot of people are getting information. So Bouba, if I could go back to you, how would you go about finding information you can actually trust and is actually easily accessible to you?
Yes, I think, starting with the beginning of your question, that's definitely a challenge. But, I was diagnosed 2012. So it's been 10 years already, and I think there have been a lot of advances. But obviously, you go to Google, you will see WebMD, as many other forms. Most of those are informational. So I think for me, the first challenge was to appreciate that these are just informational. These are no prescription, and they will tell you that. But also not to be, fearful of any negative, information you see there. So we try to just find a way as educational. So look at those information as such. But that said, it's very technical information. It's not necessarily written for patients. It wasn't necessarily written for patients. So so now we see more and more of that, like I see and many other folks sharing their notes online through blogs, social media, and so on and so forth, which I've been doing myself. So what we're doing on top of that with the nonprofit, the foundation, we founded, is to take these materials from those journals. So it have to be from credible sources. So mostly recognized or published journals, articles that we get. And the second part was also using a lot of the American Heart Associations, or even the British Heart Society information, and translating them into easier terms, easier reading levels. So let's say grade 2 or grade 5. And also in ways that are culturally accessible to everybody. So those were the words. Those are the work we've been doing. And I think, the most important information also that I've come across from other sources has been like that. And this is where this guide is so important, because it's not necessarily, jargon. Everybody has to have a jargon. We all have acronyms over that. But, when you're really stressed and going fast and from different backgrounds, it's simple to have it like a language that is easier for everybody, but also culturally you can adapt to, and so on and so forth. So that's been my experience, but I think, it takes some patience, with yourself, and also understanding that this is a long journey. You got diagnosed, it's definitely not the end of the road, but there's no quick fix. So you gotta keep it going. So we try to let each other understand, but it's like when you come across a new article, and sometimes, a verse in the Quran or the Bible, you want to share it, you want to talk about it and see what other people interpret. So I think sharing with family, friends, and just talking about it has been the one way to vet it, because if things don't make sense, they will tell each other, and you learn or unlearn and move from there.
Absolutely. And you make a really interesting point about creating resources that are not just sort of patient-friendly, but also culturally accessible. And I think a big part of that is language, because so many resources are created in English or for English language speakers. Aistė, I wonder if you might be able to comment a little bit on that, about how that might sort of shut a lot of people out of accessible resources.
Absolutely. I think, I'm from Lithuania, which I forgot to mention in the beginning. So it's a small country, and to be honest, we do not have a lot of resources. And in the beginning, when I was diagnosed and I was seeking for more information, and on any topic, when I'm trying to reach the information, for example, in Lithuanian, it's very difficult to find. You literally have to search the information in English. That's when we have access to the pool of information. So that is the challenge. And there's a lack of information, of quality information in different languages and for different cultures, so in different regions. And we see that, and I think working through the Global Heart Hub, working with different patient organizations, that we were encouraged to do. So having as much more quality information and resources available in different languages that it can be shared with the patient, so it can be accessible, it can sit on the website, on the social channels. We encourage to have for example, the patient organizations, they were having meetings, local meetings in their own country, so they can share information. What Bouba said, it's very important to kind of share that information that you have learned through your experience as well. And I can only second that on that. When I was diagnosed, and still now when I'm living with a transplant, there's a lot of people that approach me to ask about heart failure and about the journey, because if they do have some issues such as like high heart rate, they would ask me straight away, oh, is it something that they have to be worried and they have to go and get checked, what symptoms they need to look out. So that information really spreads out. So it becomes kind of a peer-to-peer support, but you kind of at the same time encourage and share that information with other people. Yeah.
Absolutely. You make some really excellent points, and especially in looking for things like local resources. And I think patient organizations are really stepping in to fill a gap of saying, patients need information and they're asking for certain resources that just don't exist. And those patient organizations are in many places stepping to fill that gap, like you have done in Lithuania. And speaking a little bit on sort of these resources, these support, we've sort of talked about the information people need and support from family and friends, but that kind of leads me to another question, which is the emotional side of your health journey. So we know that physically heart failure can be a difficult journey, but many people can struggle with their mental health as well. Bouba, how important is it that heart failure patients are able to access mental health supports, and how can care teams integrate mental health considerations into their treatment plans?
Thanks a lot. I just wanted to add on to the previous note you mentioned, and I just want to say we appreciate everybody doing the work, especially the doctors and all the systems, and then like you said, where there's gaps we fill in. So I see that division of labor. We all have 24 hours in a day, so we appreciate that, but there's definitely more to do. So coming to the mental health side, I think we heard about self-help, we heard about the stress factors. And many other cases. In my case, physically, I was still okay at the time. I was definitely more tired, but I could still be active and work and play soccer once a week. So physically, my challenge wasn't really that, but mentally, it was tough because first of all, you have to be physically consistent in terms of exercises, not just once a week. That's what I used to do once a week, and I'll crash on the couch, nap the whole day, and then go on. So. But even adapting those habits, those new habits that are crucial in the early stages of the diagnosis were important. So, whether you need a therapist, family encouragement, you need somebody that will be there with you, that will coach you through that or just support you. And those were crucial. And then, heart failure can evolve in many cases. And different time will need different interventions. So in my case, I remember, based on my background, as soon as I understood that I needed to talk to somebody, so basically ask for a therapist through work. And then we'll talk more with my family and everybody else. But then it evolved. So over time, I moved different locations. I was diagnosed in South Africa, and then I moved to Senegal. Then I moved to the US, and then the condition evolved at different times. So at the US, came to a point where now I'm living as a Black person. This was 2016, 17, 18, under the previous regime. So there's so many stresses, and then going back to work. So I had a lot of stresses to the point that I was explaining to people, my therapist and everybody, you just lived, well, I was living because I had my kids and everything, but life had no flavor. Not even that it was depression, but it's not to the point suicidal ideation and things like that. I actually went through all of that. And I passed, I navigated that, but the toughest was at the end where you're okay, I cannot really deal with this because I don't even know, there was no flavor. So being able to recognize those signs and be able to be ahead of it, those are key. So to be ahead of it, what I did is I even changed my way of seeing therapy. I would just do therapy more often. like a weekly, and then to I don't need it. So my providers were very supportive of that, and then they will support that. Likely I have an insurance that also supports it. But these are crucial. But I understand the therapists, we were at a time here that was very hard to get the type of therapist you wanted. I wanted a Black therapist, so that would be challenging. But it's really important to get a way to navigate this journey. So whether it's your own reflection, journaling, talking to people, but you need to find somebody that will help you mentally and emotionally whole and strong to navigate this journey. And I think in my case, that was definitely always crucial and pivotal. And that's something I would definitely keep advocating for. Everybody's different, but that's something to hopefully look at from the beginning, because everything you do physically will affect that. Whether we exercise or not, all of it is really to get these chemicals in your head and keep them, get your body moving and so on. So yeah, that's something I think was crucial. It was my biggest factor in succeeding up to the transplant and recovering from the transplant, and I think it makes a big difference.
Absolutely. I'm really hearing sort of looking at mental health not as something that you sort of deal with after or on the side, but as a core component of your health journey. And now that we are nearing the end of the webinar, I do want to just take a minute to bring Angela back into the discussion, because we did get some questions, and I'd like to at least be able to pose one to you before we finish. So Angela, the question I'd really like to ask you before we have to wrap up, Lebanon is currently experiencing multiple crises that is impacting health and the health system across the board. So I'd just love to hear your thoughts on what impacts this kind of environment can have on the treatment of heart failure, and what patients living within difficult conditions can do to manage their health.
This is a very important question, and I also would like to highlight that I have been answering the Q&As on the site so that patients do not leave here with questions. As for people of Lebanon, I would have to say it's a very unfortunate situation, and I wish Mr. Jacques was here. We lost electricity, that's why and internet, that's why he had to leave the meeting. There's no Wi-Fi when you don't have electricity. So people in Lebanon are living under circumstances of no electricity, sometimes inability or no access to physicians and healthcare, no medical insurance. A lot of times there's a huge burden of finding the medications. Needless to say, obviously, the important life-saving medications sometimes are non-existing in the country, so people have to get them from outside. And for you to be able to get them from outside, that will cost a lot. So this definitely increases the burden on patients living with heart failure and their caretakers as well, because of the financial struggles, because everything now costs much more. So yes, I think there are people living in different parts of the world who are less privileged, and they have higher burdens. Definitely, they have higher burdens of burnout for the caretakers. There's higher burdens there's lower quality of life. And there are definitely risks in this, because, acute therapies might not be available when needed, other than speaking about access to care. So if you live in a country that is struggling, I would say preventive health is the best option for you. Try as much as possible to, delay the progression of disease by following the self-care strategies that we had mentioned in this talk and that are available in the heart failure guide provided by Aistė and Global Heart Hub. People have to do what they have just to maintain a healthy life and, delay the progression of illness. But yes, I would say there are a lot of disparities in the world.
Absolutely. And I think that's something that is really important to highlight and understand and bring to global attention when we're having these conversations about the global care of people with heart failure. So I really appreciate you being here and offering your perspective on that.
There's also one question that I wanted to answer live, and that was very important because someone was asking me about the differences in genders also when it comes to identifying symptoms and actually getting diagnosed. And I really love the panel because we have different age groups, different nationalities, as well as different genders. So there is data that says that the symptom experience is cultural, but also it's gender-based, because women tend to delay reporting their symptoms, and sometimes they get delayed diagnoses because they prioritize everybody else's health on theirs. So that's something noticeable in a lot of research studies, and some from the Middle East. We also have a research on delayed seeking healthcare for acute coronary syndrome, which is a precursor for heart failure. It shows that women are more delayed than men, and sometimes the symptoms of women are, underscored by healthcare providers as well, because they might be silent, they might be less, less insisting. So this is something also to keep noting.
Absolutely. Thank you so much for highlighting that disparities in access to care, not only regionally, but between gender, is something that's really crucial, because again, it's important that we don't leave people behind as we're improving care for all patients. So thank you, Angela. I see we're at time, so I just want to take one last moment to thank all of our panelists for being here and sharing your experience and perspectives with us. I really appreciate your participation. I'm grateful as well to have been able to partner with Heart Failure in Lebanon and Angela on this webinar, who brings such a wealth of information and a valuable perspective. Thank you to everyone in our audience. I hope this was valuable to you, and I appreciate you spending this time with Global Heart Hub and Heart Failure in Lebanon on this webinar. You should see a survey for the webinar after exiting, which I hope you'll take the time to fill out so we can continue to improve. I'll also be sending out the recording of today's session, a link to the guide, the slides, and Angela has also been kind enough to record her presentation in Arabic, so that will all be sent out to you. For anyone interested in learning more about our work, I encourage you to reach out to me. Thanks again. Thank you for the extra 2 minutes, and I hope to see you at our next webinar. Goodbye, everyone.
Thank you. Bye.
Thank you.
Bye.